big key topic, having medical insurance prior to getting cosmetic surgery.
Yeah.
Oh my Lord.
You would think that's a no-brainer. However, apparently it's not. I've had a patient in the past where her oxygen kept dropping. It turns out she had sleep apnea.
This was after surgery and recovery
in
in PACU. Or in the aftercare? Okay,
this was already in aftercare. She'd been in the aftercare all night. Her O2 sats kept dropping. She was on continuous oxygen. We couldn't wean her off the oxygen because the second we took her off oxygen,
her levels were low.
Her oxygen levels would drop. The doctor came in to see her. He was like, honestly, I think you should go to the hospital. You should go get a CT scan of the chest. Make sure you don't have a blood clot. She disclosed, I don't have health insurance. And if a patient is alert and oriented, and they refuse to
they
go to the
have the
hospital,
right to refuse medical services.
Yes, so they can say, I don't want to go to the hospital, I refuse to go to the hospital, and you can't force them to.
Sadly, yeah.
Unfortunately. In the end, the patient ended up being okay, but that's just the topic of making sure you have medical insurance. If you're able to afford plastic surgery,
you need to figure out how to get medical insurance. I literally think that it should be a requirement in order for someone to get plastic surgery. You should have medical insurance because there is a high possibility of complications afterwards.
Yes, you just never
That's
know.
wild.
Yeah, I've had
even infection. You know how much antibiotics are, and a regular ER visit, and what you know.
I've had another patient who got a infection, fat transfer in the thigh. They kept coming into the office, getting it washed out, was refusing to go to the hospital, didn't want to go to the hospital, saying I'm fine, kept pushing it off. Went into septic shock. Was admitted to the ICU for weeks.
Oh my gosh.
And then they were from out of the state, so they had to like cancel all of their flights, their plans. They ended up staying here for like, I don't know, probably like an extra month or so longer. But
oh my gosh.
you're increasing, like, you could have just gone to the hospital to begin with, gone on IV antibiotics, and prevented the whole sepsis, essentially.
Yeah.
But
you don't have medical insurance, you're not getting the proper treatment.
And you're trying to avoid that bill.
And then you get a larger bill.
The worst bill.
You end up in ICU. Do you know how much is ICU bed per day? Like $10,000 or something crazy?
I honestly don't know, but I'm sure.
Literally, please get medical insurance. I mean, you should have it regardless.
Yeah.
I know times are tough, things are a little bit complicated, but especially if you're going to go get elective surgery, especially if you have like children, please, like it is a must. It is a big key factor.
Yeah.